My girlfriend, her daughter, went to 8th grade. My girlfriend's an OBGYN, private Catholic school, same school my girls went to. She went to school one day and she took what she thought was a sweet tart. Come to find out it was rainbow fentanyl. She died because the school did not have Narcan on hand.
That is part of a trending video on TikTok from a nurse practitioner here in the U.S. warning about the dangers of rainbow fentanyl. ProMedica's data showing that 9% of high school seniors in the Toledo School District admitted to trying an opiate that they had not been prescribed. And last year, 276 people died from overdoses in Lucas County alone. Michael Sandlin joining us live in studio. Michael, how available is Narcan or naloxone in our local schools?
Well, Jeff, while I didn't hear back from every school system, Maumee, Toledo, and Sylvania schools all say either their school nurses, resource officers, or both carry Narcan with them. Representatives from the Lucas County Health Department say it's a big step in the fight against overdose deaths, but there's still a lot more work to do.
There's a new vending machine inside the Lucas County Jail, but instead of candy and peanuts, it's full of free Narcan. Majda Stefan with the Lucas County Health Department says it's all part of continuing efforts to make Narcan easier than ever for the public to access.
This year so far, we've already done another 6,500 distributed to the community.
But Stefan says there's growing concern as overdose rates are skewing younger and younger. And with new challenges like rainbow fentanyl entering our area, it's easier than ever for an overdose to happen on school grounds.
Youth don't really understand consequences, and there's a lot of peer pressure that goes into drug use as well. So they could make a very fatal mistake by taking something that their friend gives them, not knowing what the makeup of that is.
The health department has worked directly with school systems like TPS to help them access Narcan, and would gladly help any other local school to help set programs up as well. But Ohio pharmacist Emmanuel Ayanjake says Narcan should be in more than just the hands of teachers and first responders. Everyone should carry it. He says with fast-acting fentanyl now being responsible for many overdoses, oftentimes there's only time for the person in the room to act, but they can only do so if they have Narcan on hand.
If Narcan was accessible for most people in the community, there's a high chance that they could administer it to such a person in that case. So definitely we need to have it more out there. We need to fight against the stigmatization about having Narcan on hand because it's really something that could save a life.
If you want to have Narcan for yourself, Ayanjake says most insurances will cover it with no copay, and government-run providers like Medicare and Medicaid will as well. And ProMedica reps say there are still plans to install Narcan kits on school walls within TPS within the coming months. Reporting in studio, I'm Michael Sandlin for WTOL 11.